people that can develop any side effects or any adverse after being vaccinated.
No, thank you very much. Colleagues, let's agree that let's remain so that we are allowed, because we're just too many. Yeah. Then we're going to come back and have a conversation with the principal.
Can the cameras only go?
Yeah, maybe let's allow the cameras to go along. And then the rest of us, we can then come back.
Media stand here and look that way as the minister and what have you.
Okay.
And then we hear the
I'm the manager.
Okay, thanks. Yeah, let's just remain mostly so that we don't stand create. Colleagues, let's move that way.
Where they are with
Yeah. Let's move another than alarm just done.
All right, this side, here is our dispensary. Our patients are prepared at this side, and then from the dispensary, they will come here over to the vaccinator being prepared. So we have got the runners, here are the runners who will be bringing the vaccine here. They are prepared in the dispensary. We do have a pharmacist who are doing that.
Morning, Minister. I'm Sister Shelly, Infection Control, Charlotte Mateke. I was with you in Polokwane.
Okay.
Yes.
At the range.
Oh, yes, I was at the range.
You are the brave one.
Yes, we were at the range with you last year.
I remember you now. Yes. Okay, you've got how many meals left?
0.5.
0.5. Yes. How many 0.5?
The vial comes to it's multi-dose vial. So 10, they draw 10.
You draw. And you don't lose a lot, eh?
We don't waste much.
The last bits.
We don't waste much.
Yeah.
So we make sure that we count. That's why there are people who are doing the screening. Yeah. And then when they enter, we count, we put the numbers so that we can be able to track how many we are going to get.
And drawing the last one, we don't do 0.6, 0.
So the people from the pharmacy are the ones that check, they monitor the thing. Now, the other category stuff, Minister, that's
How are you, sister? Right. Sister,
Okay. Sister Shelly, Twaram Pelema.
Colleagues, still, let's quickly take and then create space, please.
Now I'm your client. Good morning, sister. Yes. You continue. Okay.
That's the register.
No, I think you must do that, Minister, so that they can chat with them. Then
live comments.
No, what does it say?
What does it say?
I have a voucher.
You don't have a voucher. But it should be saying something there.
What is it saying?
It is saying not eligible for the vaccine.
Right, these are live pictures from the Nomathemba hospital.
You can't do it again.
Now we can proceed to this side. Thank you.
Thank you. Thank you.
They are the ones that are responsible for making sure that we do have the system up and running.
Workers have so far been vaccinated here at this particular hospital. We're also expecting the minister this morning to make a further announcement. Vaccines into so that
we have got vaccinators from a different institution. So for them, when they come here, they have to register here so that every day they can be able to communicate with their manager to say there are so many vaccinators that came. Because remember, we are human beings. There are some of those who might say, I'm coming to Charlotte Makhura, and on the way they disappear. So we make sure that we keep that record so that we don't experience a problem where people will be saying we were at Charlotte Makhura. Then these people end up not taking all the numbers and the names, they make it back to the manager. So everyone will be fine. Management system for us. Yeah, we're still doing it manual, but remember that we are doing this as a, remember once you have signed, it's a control measure. This is a control measure. Yeah.
is from the Charlotte Makhura Hospital in Johannesburg. Well, this is where the Minister Dr. Mkhize
Any problem?
indicated to inspect various vaccination sites. Well, this inspection, of course, is of various vaccination sites to check the state of readiness for the next phase of the vaccination program. As of the 2nd of March, the vaccination here of healthcare workers stands at 12,281. That, of course, cut off at 6 o'clock last night. So from the 2nd of March, when the process began at the Charlotte Makhura Hospital, 12,281 healthcare workers have been vaccinated. And the minister, as I indicated, I must apologize for a bit of sound there. The minister expected this morning to make further announcements on the arrival of vaccines to South Africa to start, which we understand will include vulnerable groups. So the inspection taking place here, you would see the David Makhura, as well as the help need by the CEO of the hospital, as well as the Gauteng Health MEC, just inspecting the vaccination process that is taking place at this particular facility. So I think of particular interest at this time is what the minister will have to say with regard to when the vaccines, the next batch of vaccines are expected in the country. We're just going to dip into this and hear what the minister is being briefed on at this point.
Observation area.
So how are you feeling?
You happy? You have the injection?
Yes,
Are you happy?
I'm ready.
Yes.
And I was afraid. Then I was thinking that I will feel pain or something. But now I'm 100%.
Did you ever have COVID before?
No.
All right, we'll leave it here for now. Desiree, we do understand that the health minister will be holding a media briefing just very shortly after this inspection, where he's expected to make that further announcement on the arrival of vaccines in the country. I'll hand it back to you and come back to you once that gets underway.
We come out of that story now to this now. President